Ear infections, one of the things we see all day long, really the most common reason we probably use antibiotics in the office. Typically, these are kind of spread out. They almost always come following a viral upper respiratory infection. And the reason for that is when your child is congested and has a lot of swelling inside the nose and the back of the throat, that is exactly where the middle ear is supposed to drain through the eustachian tube into that area in the back of the nose. And when your child is congested, the normal drainage just can't happen. So fluid accumulates in the middle ear and then eventually becomes infected with the bacteria that just live in that area. The typical story is your child will get a cold, everything's going fine, kind of rocking along, congested, cough, maybe not sleeping very well. And then he starts waking you up at night, maybe running some fevers, sometimes pulling on the ear, not eating so well. That's usually when it's gone into the ears, and we may need to see the child and maybe to start some antibiotics. So if this is the course that your child is following, especially if your child has had recurrent ear infections before, it's a good idea to go ahead and come in. It's important to sort of keep track of how many ear infections your child has had so that we can know when it's time to be referred to a specialist.